Well, back pain is common and is one of the most common reasons as to why people will visit doctors, and even some will miss going to work. And it is said to be the most common cause of disability worldwide. Thank you for finding time to join us, and Health Nuggets starts now. So I said earlier today we are talking about back pain, and with the help of Dr. Wausi, we are going to look at a normal spinal cord and how the spinal cord will look like once it develops problems, hence leading to back pains. So Dr. Wausi, you can just take it on and help our audience understand.
Okay, so thank you so much for the opportunity. So this is basically how a normal human spinal cord looks like. Yeah, it is, as most of us know, is the spine is not one unit. It is not one fused bone. It is segmental. It has got different segments. And the most important thing to note in a spine, as you can see, is that it's not also straight. It is curved. And the curves are very important. The curves are very important. They are important for weight distribution, so that the slightest injury, the slightest fall does not cause you an injury, a serious injury on your spine. Like if you sat down, but the force from the ground will not affect the whole spine. It will basically affect just one part of the spine. That's the importance of the shape. I'm talking about the shape of the spine. It's S-shaped. So because of different kind of things that happen, injuries, the shape sometimes is distorted. So that is number one cause for back pain, when the shape is distorted. Sometimes you can have what we call an increased thoracic curve. This part is called the thoracic. So when this one is increased, that's a problem. When it is reduced so that it comes somewhere like that, that is a problem. And when this lumbar curve, the lower part of the back is called the lumbar. So when it's reduced, it's called lost lordosis. So that's a problem. So I'll start by saying that the upper part of the spine, which is the neck basically, is called the cervical. Yeah, it has got 7 segments. Yeah, and then the following one is thoracic. The thoracic is more of the mid back, yeah, which is like curved a bit. So that's called the thoracic. Yeah, vertebra is just the name for the bones. So the thoracic is the mid back, and then the lower back is the yellow part, and this is the most common part that hurts when you begin to get back pain. So it has got 5 segments, and then finally we have the sacrum. The sacrum is the lowest part of the spinal bone, and there are 5 of them, and they are fused. Yeah, and then down we have the coccyx, what we call coccyx. So basically this segment, and then for your information, the spinal cord itself, these are just the bones. The spinal cord passes in between. Yeah. It passes there, down, all the way. And then the nerves emanate from here. See these spaces? That's where the nerves come from, to different parts, to your hands, to your chest, to your internal organs, to your butt, to your legs. They distribute. So basically everything that happens, even the way I'm moving my hands, it is all communicated from the spine. So, and that's why the spine is like the CPU of the computer. It is basically the control unit of the human body. So that it is basically very important. That's the normal, that's how a human spine looks like. That's a normal one. Now, if anything here is distorted, that becomes, now that's where back pain comes from. Yeah. The spine is also on top there is a human head, and then down here we have legs. Yeah, and then around the thoracic area we have the rib cage. Yeah, you understand? So the rib cage comes from the thoracic spine all the way to the front. So that's basically the whole skeleton. So now let's look at the spine when now problems start setting in. Yeah, so a normal disc will look like this. yeah, and a disc is jelly-like. It is a bit slippery. It's not so hard like a solid. It is able to move, and that's why a serious injury like a fall can affect your back. Yeah, so that's it is usually between each two bones. Between each two bones, there is a disc, right? So that now the spine passes here. That's where the spine is passing through, all the way from the brain. The spinal cord comes down through here. So now, different things happen to cause the injury to the spine. I will come to that. But the first injury that can happen to the spine is called a degenerated disc. This happens due to age. It starts to reduce in terms of the water that makes up the spine, the disc. It starts to reduce, and then it starts to harden. So that's a disc that is degenerating. The other thing that can happen is a bulging disc. From the word bulge, the disc bulges out, and it is bulging towards the spinal cord. And what can happen here, this is a person who will present with numbness to the hands or to the legs, or pain, a lot of pain, because now this disc as it bulges towards the spine, it compresses the spine. So whichever nerve has been compressed will now cause pain to that specific part. If it's the leg, if it's the hand, if it's even the hip, whichever part is compressed, it will now present pain there. Now the other thing that can happen is an herniated disc. When a disc herniates, it's like comes out of its sac, because there is a disc has a normal sac. So the fluid tends to come out of its sac, yeah, and it pushes towards the spine. So now this is more serious than this. And then we have a thinning disc. A thinning disc tends to wear down. Yeah, the water reduces and the disc reduces in size, and then reduces the height of the bones tend to come closer. So that's another. This mostly happens with age. As we age, your disc does not remain the same. It tends to do what we call degeneration. So that's a disc that is degenerating. So the next thing that happens is now the bones start to come in. Yeah, as the bones, as the disc thins and reduces in size, the bones start to get destroyed. What would happen to any other bone, even on your knee? If the fluid is reduced, then the bone now starts to wear down, what we call wear and tear. And that's now what we call osteoarthritis of the spine. You see, the reason why you are able to bend and rotate is because of these bones. Yeah, and the disc allows for that. If you did not have a disc, you would have a very stiff back.
So you can't move.
You cannot do this. I am moving like this because my bones are gliding on each other. My spinal bones are gliding. If they were fixed, then I would just be able to move like this without moving my back. But because my discs are allowing for a smooth glide, a painless glide, that's why I am able to move. Now it allows you to make very complicated movements because when the disc is normal. But now when the disc starts to degenerate, which is the normal process of aging, when it starts to degenerate, then movement becomes a problem.
I had so much pains on the hands, like that I could not even be able to carry a hard bag fully packed for a day. So I could even omit some things in the bag because I could not be able to carry the hard bag. The hard used to be very painful. I could not even be able to comb my hair well. That is why even I've decided not to do it. So I could feel so much pain all the way backwards. I've been told the cause. It is about the muscles, tenderness in the muscles, stiffness. That is, I don't know the language they use, but it has been like that. Unfortunately, I could only ignore the pains And I could see that I've worked so much, I'm feeling so tired. So I only needed to stretch and wait for tomorrow to continue with my normal duties. So I didn't know it was that serious.
Maybe for lack of a better word and an easy understanding to our audience, we'll say that this is an abnormal spinal cord. Maybe you can just now talk of what causes this.
Okay, so disc problems can present in almost anybody. So number one, injury predisposes you to injuring the spine, like a car accident or a bad fall. That one can give you a disc that is herniated or even bulging. Number two cause of back pain, and this is the most common today, is lifestyle. If you are sitting all day, all month, all year, your disc will not remain the same. Yeah, you continue to do what we call compression. Your spine becomes compressed, especially if you do not exercise. If you do not exercise, then actually this is important. If you do not exercise, then you develop weakness of especially core muscles. Core muscles are those muscles which put the spine together. For your information, the whole skeleton we are talking about here is put together by muscles. So a muscle is a very important thing, in that if a muscle is not giving the skeleton proper support, then that's when these things start to come in now. If your muscles are not strong enough to support the skeleton to move in a certain way, then the pain comes in. Yeah. So one of the causes of back pain is weakness. And that one we have it in plenty today, because many people are spending a lot of time on the desk doing their jobs or sedentary kind of lifestyle, and they are not working out. So you get very weak muscles, and your spine is not well supported, and you develop, now the disc starts to give way, because a slight fall or sitting for 1 or 2 hours gives you pain, and your disc starts to get compression, and then back pain comes in. So another cause of back pain, and which is very common, is a sedentary kind of lifestyle, where now weakness comes in. So weakness now allows for your spine to start having these kind of complications. Another one is the now aging. As you age, there is what we call degeneration of both the disc and the bones. Yeah, so the disc wears down, the fluid reduces, the height of the disc reduces, and as the height of the disc reduces, then it gives the bones an opportunity to start what we call wear and tear. Wear and tear is now what we call as osteoarthritis. So now osteoarthritis becomes painful. But I must mention that most of these are preventable. Yeah, we can learn to work out, we can learn to exercise, we can learn to wear better shoes, so that now you don't affect, because the kind of shoes you wear can also affect the normal curvature of your back. It can affect the way your spine is, and then start slowly. It is usually very gradual. It starts slowly, and then with time you realize, oh, this habit now has ultimately caused me this kind of problems. Yeah.
Okay, so you've said it's a gradual thing.
It is very gradual.
We can maybe talk over the symptoms, because I'm sure each and every one of us has had pain at some point in their back. What are some of the things that you should look out for for you to maybe seek medical attention?
Yes. So many people will relate to back pain. Actually, I would say 8 out of 10 people in a normal population have had back pain, or are actually having back pain, or will have back pain. So it is very common.
Despite the age?
Yes. Even in teenagers nowadays. Even in teenagers, back pain is very common. So what happens is you get that back fatigue. You feel like your back is so fatigued. probably by the end of a long sitting day or a long working day, and you get fatigue on your back, and you say, oh, I just need to rest, or I just need a simple massage. No, the back is communicating. And the body has a beautiful way of communicating. Now, that simple fatigue that you feel today, tomorrow is gone, the other day it comes. Now, that is communication. The back is telling you all is not well. Or that day you just lift and you feel a sharp pain and it goes. Now, that's how things start. It starts slowly. It starts as a simple, small pain. And then it becomes more frequent, you know. It now starts to come every week. After that, it comes every day, yeah. Like a daily headache, yeah, daily back pain, or it even starts after childbirth, and you say, oh, mothers, they always have back pain, yeah, or I'm aging, so back pain is okay. No, it is not okay. If it starts hurting, just sort it early, because what happens when, especially the lower back, I'm very passionate about the lower back because it is so basic. The lower back is so basic. If I strain my lower back, the first part that will suffer is my muscles. I'll get, oh, that was pain. You'll get a simple pain, yeah? If you do it again and again, probably it's a bad shoe you're wearing, or is a bad office chair you have. So you do it today, you do it tomorrow, you do it another day, and the pain keeps building. Now that discomfort becomes more often, comes more often, and becomes more common. Now, the more it becomes common, something is happening. It's not just a simple strain as you call it. So the muscles now start to tighten. Start to tighten and tighten and tighten, and then it becomes more frequent, like you're having it every day, every time you wake up, or every time at the end of your working day. After you've been working, the back starts to hurt. So now, once that spasm or that pain on your muscle increases and builds up, now it transfers to the skeletal system, because the muscles are basically holding on the bones. So if the muscle holding on a bone is tightening with time, what is happening to the bones? Specifically the spine. Now, these are muscles that are putting together the spine. So they will start to put compression on the bones. And you now, this is where you talk about disc compression, disc bulge, because the muscles are putting a lot of pressure on the bones. And the bones in return are compressing the disc, and that's why we get disc bulge. And now the disc goes on to compress on the nerves on their exit. And then now you start from a simple fatigue. Now you start saying, oh, my leg is hurting. I am having a sharp pain. I am having a numbness. I am having sudden weakness. You know, I am having some funny kind of pain. I can't walk without pain. I cannot sit for long without pain. When you sit for long, your leg starts to get some sharp kind of pain, or some numbness. Or when you sleep in this certain position, or when you turn in bed, you start having problems. Where did it start from? It started from your muscle getting a simple fatigue. And then now you continue doing the wrong thing because you did not know, of course. So that strain you are giving your back now transfers to a lot of tension on your muscles, and now those muscles pull on the bones, and the bones pull on the disc, and the disc put compression on your spine, and now the spine starts to give you funny pains. You never hurt your foot, but it hurts. Yeah, it's coming from the back. So the muscles are usually very primary. They are usually very primary. So once you get that simple strain on your back, don't ignore it. So this is what I believe. Almost every back pain does not have to end up like this. If only it is prevented early. If only you address that simple back pain. Yeah. But most of us want to say, oh, I have had a baby, now I have to keep this pain. I have to live with this pain. Yeah. You do not have to live with pain, because it will never remain the same. It will keep progressing. It will keep progressing until when you are around 50 and it's a serious problem, or you need to see a surgeon. They need to like, this one has to be excised. Yeah, they need to do some surgery and sort the bones, yeah. But you could have prevented it from the start.
So we've seen that the spinal cord is a very key organ in our body. And how bad do you think this can go? Could it affect other organs in the body other than the tissues and the bones?
Yes. So as I said, the spine is a control unit. Yeah. You will not move your hand without your spine. It has to be coming from your spine. You will not make a step without your spine. Your legs are not independent. They actually totally depend on the spine for communication, for innervation. The nerves come from the spine to innervate your legs so that now your legs can move as a result of the message they got from the nerves. Yeah, the nerves which are coming from the spine. So now, apart from the muscles, every other part can be affected. The spine can also cause GIT issues, can also cause constipation, can actually cause incontinence, yeah, because the nerves for your perineal muscles, every sexual organs, all of them are controlled from the spine. So actually you can have deficiencies on those areas as a result of nerve compressions. There are patients who have sexual dysfunctions, and all you need to do is sort the spine. There's no other problem they have. You just need to sort the spine. Yeah, there are people who cannot. Have you seen people on wheelchairs? Some of them just have a simple, not a simple, a serious spinal problem that started as a simple back pain, and now it became a serious disc problem, and now either it is totally destroyed, or they need to undergo some surgery, or some disc problems, some spinal injuries are irreversible. Yeah.
So you've talked of exercise and maybe proper sitting position as a solution or as a prevention method for back problems.
Yes.
How does the treatment look like?
I will tell the patient to bend as I try to look for the pain. Now I'm trying to look for the activity that provokes the pain, because you can have back pain that is provoked by different activities. So does that hurt? Penina? Yeah. Does that hurt? Okay. Come up. Number 2, I'll ask her to bend backwards. Now, whatever movement we are doing here, we are affecting the spine. We are affecting the spine. So if the spine has different kinds of problems, each activity can provoke a different kind of back pain. So there are types of back pain which bending forward can cause you pain. And there are types of back pain which bending backwards can cause you pain. Remember, each movement is causing a certain effect on the spine. Another movement I can test is rotation. Does that have pain? There are people who have a lot of pain with that movement. So if I ascertain that is a movement that is causing the patient pain, now that I will approach it from that angle. If that's the activity that is causing the patient pain, I will approach it differently. Yeah. And then there is side. Try to reach for your knee. That can be a different kind of back pain as well. Yeah. And the other side. Yeah, come up. So I'll ask my patient to lie here for a further examination. So this examination is going to help us to ascertain what is the problem with our patient's back, and it will also guide us with the treatment that we are going to do. Number 1, I'll ask my patient to bend her knees, both of your knees. Please put your arms down. Yeah. So what I'm going to do, I am going to push like that. So what I am doing here, I am causing pressure on the lumbar part of the spine, on the yellow part. So my thighs are putting pressure on the lumbar. If the problem is on the lumbar, the patient will say it is very painful there. If she has a weak core, if she has weak core muscles, or the muscles supporting the lumbar are weak, then this will cause her a lot of pain. So I'm looking out for the lumbar right here. Yeah, this can also be a test for knee pain, because if I do this and the knee hurts, that tells me something. If the thigh hurts, that tells me something. If the hip hurts, that tells me something, right? The next thing we are going to do here is something we call pelvic rotation. You see what's happening to that hip? She is lifting this hip, the opposite hip. Yeah. Some people, especially if you have a problem with your hip, they will say that the groin hurts in that position. So if the patient says the groin is very painful in that position, I will know there's a problem with the hip flexors. Yeah. And the same on this side. See, actually this tends to move more than this. This one is maximum, and I'm actually pushing much. This one goes by itself. So that tells you that something is not right on this leg. Yeah. So I also go ahead and ask her to lift like this. Lift this leg. So if somebody has a problem with the pelvis is a hip. If somebody has a problem with the pelvis, this will be very painful, because the pelvic bone are two fused bones. So sometimes they are distorted. Just put this down. Sometimes the pelvic is distorted so that the alignment is poor, and that causes pain. So if the patient lifts one hip and there's a lot of pain here, you know there's something with the pelvis. Yeah. If either of them hurts, you know there's something with the pelvis, and you have to treat the pelvis. Yeah. So that's basically the examination for the lower back and the pelvic area. Yeah. So just how the spine looks like will lead you to other things. Because there's a patient who will think, oh, my chest pain is pneumonia or something. A distorted thoracic spine can cause chest pain. That back pain, if prevented early enough, can save you a lot of time and money and pain. Yeah. So back pain is best treated early. Yeah.
Well, back pain being one of the causes of disability worldwide, when you feel that pain, do not wait until it worsens. Seek medical attention as soon as you can, and also exercise regularly. Look at your sitting position and wear the right gear as far as shoes are concerned. And we've heard from Daktari as well, do not rely on painkillers. That is all we had for you from Health Nuggets. My name is Aida Munzati, and as always, your health matters.